Hello, so I am unable to do my video with a patient because I tested positive for COVID last Monday, and I still have not been able to go around my family because my parents are older, and my friends don't want to be around me because it's the holiday season. So I am going to do this video as if I have somebody with me, and we're just going to go from here. So the topic I chose is Gerd, and this is actually something I've struggled with and a lot of people in my family have struggled with, so I felt like it would be a great topic to kind of like delve into as if I were talking to a patient. So Gerd is a chronic condition where stomach acid flows back into the esophagus, causing irritation. So you have a lower esophageal sphincter, and the lower esophageal sphincter gets weakened and stomach acid flows back into the esophagus. No stomach acid is actually supposed to be in the esophagus, and this can cause a lot of pain, irritation, especially when trying to go to sleep at night. So advising to my client to sleep upright will be, I would say for me, that was a first, but that's really important when looking at GERD. So common symptoms of heartburn aren't always burning. It can be excessive burping, it can be chest pain, it can be pain that actually wraps 360 degrees around, and it can actually be felt in the back. It can be felt as extra mucus in the throat. It can be felt as a bad taste in the mouth because you have such harsh acids being sent upwards, and this can cause a lot of difficulty even swallowing. I think it's really important when talking to a client to emphasize, even if they've never been to a GI, to get an upper endoscopy or do a capsule endoscopy to really make sure what's happening isn't Crohn's or colitis or something being missed. They can also biopsy for true celiac disease, which is important, and also look at the whole way down, so from mouth all the way to esophagus, all the way to stomach. So I think advising a client first when coming in for a consultation is to first look allopathically to a doctor to make sure that what's going on isn't, you don't have active bleeding in the GI, because if you do have severe or untreated heartburn for a long period of time, it actually can cause ulcerations, and there also can be bacteria in your esophagus, H. pylori, which can be easily treated with a round of a Prev pack, which would be an antibiotic and a few antacids to kind of help alleviate that. And a lot of times complete resolution can be found. So emphasizing to a client to first get an endoscopy, see what's going on. Once that is done, you want to do pH monitoring and look at the pH of the stomach and kind of see throughout the day, making sure there is enough stomach acid to break down the food, and if there's active ulcerations, doing things that treat that, while also helping increase acid and nutrient absorption. So lifestyle changes, this is something that's really individualized because people can have food sensitivities that aren't overtly like heartburn causes, like alcohol, spicy foods. Some people can be lactose intolerant, and that can cause a lot of mucus in the throat and heartburn-like symptoms. So I think cutting out, coffees, spicy foods, sleeping upright is a first kind of pinnacle when you have GERD, and then looking into other things that you're eating, because maybe there's a trigger that you don't know about. So doing some other testing with a client to see, and also there are things you can eat before eating foods that are going to trigger you, so you don't perpetuate that acid cycle. So something like pre-leaf will actually take the acid out of foods. Let's say you have a cup of coffee and that's something you enjoy and you don't want to give up. Taking something like pre-leaf before indulging in that cup of coffee will actually take the acid out of the food. Doing things to buffer, if you are going to have highly acidic foods, to buffer that acid so it doesn't create further damage and further wearing away of that thin mucosal lining. So small, more frequent meals is also really important when dealing with heartburn, because your stomach needs time. You don't want to have a completely empty stomach. Your stomach needs to be coated. Smaller meals, so there's also not that pressure coming up and weakening the lower esophageal sphincter. Looking at lifestyle choices, like smoking. Smoking is something that actually weakens the lower esophageal sphincter, and causes a lot of people to have heartburn. So sometimes just quitting smoking can help strengthen that muscle tone and decrease the acid from coming back up. Smoking and drinking both. And caffeine intake also is another contributor to reflux and weakening of that esophageal sphincter. And these are things millions of Americans do every single day. Have 4 or 5 cups of coffee. It's acidic, it's lowering esophageal sphincter, and it's also increasing your cortisol, which having high cortisol, high anxiety levels will also increase stomach acid production. Cortisol does increase stomach acid production and can cause heartburn. So educating my client in those things, and also talking to them about weight loss. So, I mean, when the stomach, you kind of assessing the client and looking at their BMI and looking at, from face value, what you see. If you see somebody is overweight, being overweight is a huge contributing factor to reflux, because that extra weight on the abdominal cavity actually pushes up on the stomach and up against the sphincter and can cause a lot of pain and exacerbate heartburn. So those are really simple things that you can do. And if they're not getting resolution from cutting out spicy foods, fatty foods, eating more frequent meals, sleeping upright, losing weight, there's other, doing a stool test, doing a food sensitivity test, looking at stress, and then also making sure they've been evaluated for H. pylori, because that's something that can be easily treated with an antibiotic. Or if you want to try a more natural route, you can try things like oregano oil, mastic gum. Those are all things. So when we're talking to the patient about nutrition and lifestyle, obviously weight loss being a pinnacle, but following a more anti-inflammatory Mediterranean diet will naturally bring the acidity of the whole stomach down. And you're also going to be getting more nutrients from your food, and increasing stomach acid. So a lot of people don't actually have the amount of stomach acid needed to break down food, and that actually can paradoxically cause reflux. So starting with a really high quality probiotic, I think if anybody comes in complaining of acid reflux, making sure they're on a high quality probiotic, 50 billion colony forming units first. Starting something like aloe vera just to immediately soothe the digestive area, or papaya enzymes are great, a digestive enzyme with every single meal. And then also incorporating something like glutamine to heal the stomach lining, and kind of that mucosal barrier is so important, then making sure the integrity stays. So really encouraging them to not take things like NSAIDs and really keeping that digestive fire high, so they're breaking down the food, but also keeping that mucosal layer thick so things are not eroding and causing ulceration in the stomach. And this definitely will take time. I think that radically advising somebody, depending on the client, to maybe cut down coffee, stop smoking, stop drinking, is a huge lifestyle overturn. So you really want to look at somebody's lifestyle and take like a bio-individual approach with them on where they're coming from and what are the contributing factors, because everybody's heartburn is not the same, and everybody's GERD is not the same, and finding the key, but really sticking to a Mediterranean type diet and start eliminating things that can be possible triggers until you get to that sweet spot. Drinking a little bit of sodium bicarbonate in water throughout the day can also help neutralize a lot of that acid instead of taking something like a PPI. They have linked long-term PPI use to dementia. There's also tons of malabsorption issues that go on when you're taking PPIs, so you're not absorbing B12, magnesium, zinc, mostly all your B vitamins, but in particular B12. So getting people off things like Nexium and proton pump inhibitors, I think, is a pinnacle to any treatment plan for treating this. And then taking things kind of PRN, whether it's a Pepcid or an H2 blocker, they don't have the detrimental risks that PPIs do, because the PPIs actually eliminate all acid in the stomach, so you're completely starting with dysbiosis. You're starting out with dysbiosis right when the food goes into your mouth because you're not assimilating and breaking it down appropriately. So that's really important, working with a doctor and providers to get people maybe weaned off their PPI. So following up every 4 to 6 weeks, depending on the severity of their case, would be really important for the patient to come in as frequently as possible when they're coming off of a medication, and maybe adding something else in more mild, something like a Tums every now and again, cutting out those acid foods. And educating the patient on the risks of long-term use of PPIs, I think, is very important, because even though they're sold over the counter, it does not make them safe. They can be used just for short term, but ultimately getting them off is very key. And then also ulcers, educating the patient that untreated GERD and reflux can cause ulceration because that acid is wearing away perpetually at the lining of the stomach and can actually cause ulcers to form, which will bleed, which will be noticeable in the stool, but that can be very painful and dangerous. And Barrett's esophagus, that can cause cancer of the esophagus, very common, very dangerous, and also it can increase your risk of esophageal cancer. So those are all things that you want to educate your patient about, because these are things that do happen, and GERD is so common, but the risks are really there, and making sure that they're aware of that potential risk. And also making sure you're working very closely with their GI or primary care provider. For people that do have things like H. pylori, retesting, making sure you're constantly testing and constantly following up, making sure their condition hasn't changed, making sure there is no active bleeding, making sure that they're comfortable, and really building a rapport with the client is most important. So I guess the key points here are kind of taking every patient bio individually, because you don't know, every symptom can be different, but cutting out the main triggers for reflux: spicy foods, coffees, eating more frequent meals, decreasing fatty foods, while also soothing the digestive tract, and trying to get that lower esophageal sphincter to stay closed and appropriately close, when opening and closing when needed, and not staying open. And I think that's all. Thank you so much, and I apologize about the COVID. I've been really sick, so I haven't been able to have anybody here. I hope this is good.